everyone, welcome to your practical demonstration for work on the cervical area or your neck massage. So what I'm going to do is I've got a client here waiting on the table. I'm going to walk you through what we've gone through in theory in regards to your anterior and posterior triangles, so we know to watch out for those endangerment zones and areas, and then show you specific techniques for the muscles that we're going to be focusing on in the cervical area. Okay, so you should be able to see that way. Okay. So the majority of your neck work is going to be done when the client is supine, okay? If you've started with, say, back treatment, then you could definitely get into some of the posterior cervical muscles a little bit, but I find when the client is in supine, I can still really get into those posterior muscles quite effectively, as well as all of the lateral neck muscles and the anterior neck muscles as well, okay? So first, we're going to start with a nice effleurage. Take a nice deep breath in, please, and release. So you don't want to use a lot of oil, okay? Especially up when you're getting closer to the upper part of the neck and their hairline. A few things you can do is, especially with your female clients, you can go ahead and wrap their hair, which a lot of clients actually ask for, depending on the actual materials that you have at your disposal, okay? So I'm going to show you without wrapping, and then I will show you near the end how you could go ahead and wrap the hair. So we're doing nice effleurage. It's nice broad stroke, less pressure going up, more pressure going down towards the heart. So this is applying my oil nicely, but it's also introducing them to my touch in this area. And it's starting to increase some circulation as well. So you're molding your hands to their neck and shoulders. I try not to put a lot of pressure on both sides, coming down on the anterior part of the neck. It can be a little bit of a tricky trigger zone for a lot of people, and it can make them feel like they're being choked a little bit. So you just want to be really cognizant of your hand placement. So I like to warm up both sides, and then I start to work on one side of the neck at a time. And this is because of all of the blood vasculature going up the neck that goes ahead and feeds the face and the brain. We don't want to be compressing both at the same time if we're doing any more specific or deeper work, because we do not want to inhibit any of the blood flow that's reaching the brain, okay? So what I usually do is I like to tilt them over to the side, and I like to have a barrier from my hands so that they're not getting any oil on their face. So what I usually use is either a towel here, or I wrap my hand underneath the base sheet, and then I slowly, slightly tilt their head away from the side I'm going to be working at, just because you'll see how it really opens up this whole lateral aspect of their neck, okay? And then I've got my towel between their face and my hands so that I'm not getting any oil resting on their face. And we want them to relax, and we don't want them tilting too far over to the side, so I'm keeping my arm here as a barrier. And I'll show you when I go ahead and tilt them to the other side how that arm is going to look a little bit clearer. So then I would continue into a modified effleurage just on the one side. And then I'm going to go ahead and start working on some more specific muscle areas since we've done some general work, okay? So what I usually like to do is some nice fingertip kneading. Remember, pressure is going towards the heart, so I've got more pressure on the downstroke than the upstroke. And I'm going over their sternocleidomastoid muscle, or their SEM. Remember, that's running from your mastoid all the way down to the clavicle and sternum. So I'm making sure that I'm hitting all of those origin and insertion sites. And then I move over to going over his scalenes. So we're going over anterior scalene, middle scalene, and posterior scalene. Remember, those are originating up into the cervical vertebra, and then they're attaching down into your first and second rib, depending on which scalene that we're talking about, okay? So I'm still just doing nice fingertip kneading. Now I'm using fairly good pressure. You'll know if you're using too much pressure if you can feel their pulse beneath your fingertips, probably too much pressure. So you're going to want to go ahead and lighten up a little bit. And then I move over more lateral to posterior. So I'm going to start to get bits of the upper trap fibers that are coming up and attaching into the base of the skull. And then I'm definitely more posterior now, so I'm getting into those suboccipital muscles. Still with those fingertip kneading, pressure in the downward stroke, more so than the upward stroke. And that rounds out my fingertip kneading, okay? Then we can go ahead and move just to some nice deep strokes. Now you can do this with fingertips or you can do this with thumbs. Usually more anteriorly, I'm doing it fingertips. My pressure is more down. And I'm really feeling for any adhesions, any fibrosing through these muscles. And I'm really ensuring that I'm getting as close to the origins and insertions as possible. Now what I find works really great, instead of using fingertips, once we get to the upper traps, more in the posterior lateral side of the neck, is I like to take my knuckle and I start at the base of the occiput and then stroke all the way down over the top of the shoulder to get as much of those upper trap fibers. And then I can continue with those deep strokes down the posterior side of the neck, including the upper shoulder. So remember, we've got your anterior triangle, which your borders are the midline of the neck, and the anterior border of sternocleidomastoid muscle. And then you've got your posterior triangle, which the anterior border is the posterior border of sternocleidomastoid muscle, and the posterior border is going to be the upper traps, where the upper traps come down, okay? We want to be careful when we're working deep into those areas because of the nerve plexuses and the vasculature that runs in these areas, okay? We're sensitive and we don't want to cause damage. Now we want to make sure that we're trying to get a few of the suprahyoids and infrahyoids. At this point, usually I can get some more of the infrahyoids. So it's all the muscles from hyoids down. And I'll show you where I address these suprahyoids once we bring the neck back to midline. So I like to make sure that I'm going through and I do a few passes with the fingertip kneading and the deeper strokes. Really getting down underneath that clavicle, not too much pressure, but down into those scalene muscle attachments. So those can be tight on quite a few of your clients. Now, upper traps is a lot more dense up here, so what works really good is some nice knuckle kneading as well. You can use just your upper two knuckles, or you can use your whole fist. So the upper two knuckles, I like to do some nice circular kneads through the whole upper traps. Or you can do more of the fist kneading. want to always pay attention to all of these suboccipital muscles in here at the base of the skull that are running between C1, C2, and the occiput. So you can do some nice little fingertip kneads in there. Is pressure okay? Remember, pressure more going down, but there's still some pressure coming up as well. And you can do some cross fiber movements against those muscles as well. And I'm really feeling for the base of the skull and just inferior to the base of the skull. I feel that muscle mass, which is the groupings of your suboccipital muscles. Always make sure to really clear everything out. And I do that with the modified effleurage stroke, my pressure going down towards the axillary and the anterior of the sternum. Any of the accumulated metabolites that were stuck in overly tense muscles we might have released, and now we want to flush them out to reduce any sort of congestion. A good one that you can do as well is a nice deeper stroke over these upper trap fibers. So what I do is I gently pick up the client's head. I move this hand under that has the towel. And what I'm going to do is I'm going to take a nice knuckle right at the base of the skull. And then as I stroke down over that border of the upper traps, I'm going to laterally flex their head towards their shoulder so that I'm stretching out those upper traps as I'm doing the nice stroke down the shoulder. That way I find you really can get into those upper trap fibers. Pressure okay? Okay. So once you've cleared them out really good on that side, now this is where we're going to move over to the other side. So this is where I said I would show you a little bit better. I've got the towel over my hand. I'm basically cradling their head with this hand. And then I have my forearm up here. So I'm gonna have the towel kind of over your face a little bit for a second. So you'll see my hand is kind of cradling the base of the skull and grasping the shoulder. So then I've got the towel over and the client's side of their jaw and head is resting against this hand and forearm, okay? That way we're keeping them from going into too far of a rotation. And then you want to go ahead and repeat on the opposite side everything you just did on that side. I find that's very important to make sure you're doing the same sequence of techniques that you just did on one side to the other side so that the client feels balanced. Trust me, if you don't do the same sequence of techniques or you spend less time doing specific techniques than you did on the other side, the client's going to feel it. So we want to make sure that they're balanced. So I'm doing that modified effleurage stroke just to warm up those tissues. And then I'm going to start my fingertip kneading. And I'm moving down with my pressure on the downstroke towards the heart, going over some of the infrahyoids, the sternocleidomastoid or SCM muscle, and then moving over to the scalenes, your anterior, middle, and posterior scalenes, which are originating up in your cervical spine and then inserting down into your first and second ribs. So those are all your laterals, and then moving more into the posterior. So doing some nice fingertip kneading over the posterior aspect of the cervical spine, getting the upper traps and those other deeper posterior cervical muscles. Then we can do the nice deeper strokes with fingertip or thumb. I try to use my thumbs a little bit less, which you will find the more you are in this profession. You find different techniques to rely less on your thumbs, because that's where we get more of our repetitive strain injuries. And then doing the nice knuckle work from the base of the skull down the upper traps all the way down to the shoulder. So we can do the knuckle kneading with the first two knuckles, or we can use the whole fist kneading. And a nice circular motion over that muscle bulking of the upper traps over the top of the shoulder. Chances are you'll feel a nice little funking when you're getting more to the posterior aspect, and that is actually going to be because you're going over perpendicular to the fibers of levator scapula muscle from where it attaches to the shoulder blade and moves up into your cervical vertebra. So it's tight on almost everybody. And the nice full fist kneading, which you can't really see from this angle, but I want to make sure my client is balanced. And then I'm going to go ahead and pick up his head so that it's resting in my hand. And then as I'm taking that knuckle all the way from the base of his skull over the upper traps and move his head away from his shoulder as I'm doing that nice deep knuckle stroke over the ridge of the upper trap muscles. And then make sure I address those suboccipital muscles again. So some nice firm fingertip kneads in there. Right inferior to the base of the skull, do some nice little perpendicular, almost like a cross fiber motion to those suboccipitals with your fingertips. And you'll, as your palpation skills grow, you'll actually feel that you're going perpendicular to those suboccipital fibers, especially if you've got a client that has very, very tight suboccipitals. Most people have quite a bit of hypertonicity in those suboccipital muscles. And then make sure we're really clearing out with that modified effleurage, more pressure on the downstroke to flush those metabolites down to the nearest lymph drainage zones. So now we'll put the head back to the midline. At this point is when you can actually wrap their head. I'm not sure if my towel is big enough. So what I usually do is I lay a small towel below, just so that the end of it is right at their suboccipitals or the base of their hairline. And then it's almost like you're wrapping the towel as if you've washed their hair at the hair salon, and then tuck. This way you can see all of their hair is completely wrapped by the covering. We can do a lot of scalp work through the towel as well. This towel's a little small, so it's not going to stand that well. So then I can continue with my effleurage strokes. And then this is where I like to get into those upper traps again. I'll have double fists, and I do an alternating fist knead through the bulk of those upper trap muscles at the tops of the shoulders. And then you can also take the upper parts of your knuckles, and I do an alternating knuckle knead as well. And I also always intersperse all of my petrissage techniques with either an effleurage or a modified effleurage into a stroke. It's just a nice transition to changing over techniques. Another good one to do is you take your hands and you're basically going to shimmy them underneath the client into their upper back, and you're going to feel for your fingertips to be on either side of their spine, starting between their shoulder blades, and then you're going to go ahead and curl your little fingers up on both sides, either side of their spine, and then you're going to pull all the way up on either side of the spine, all the way to the base. Then I pick up the client's head. I'm resting it onto the palms of my hands. I'm still going to curl my fingers all the way into those suboccipitals. And then I'm going to let the weight of his head fall, so that basically my fingertips are pushing in and resting right into those suboccipital muscles. If you hold it long enough, especially if those muscles are really hypertonic, they will gradually start to release, and your fingertips will melt in, and you'll actually be able to start to feel the very upper cervical vertebra. Feels really good at this point. Once you've done this, which is what we call a post, then you can go ahead and grip the base of the occiput, and I usually try to just position my hands so that they've got a nice grip, but the majority of my grip is at the base of the skull, and then I lean my body back, so I'm almost giving a nice little pull of the head to lightly traction out the cervical vertebra. You're going to learn more of this technique when you get into your joint play, into your second year, but I think it's important for you guys to learn this nice cervical traction at this point when you're giving good neck massages. And then I transition those techniques with some nice effleurage. Now we don't want to forget about those suprahyoid muscles. Remember, those are in the anterior neck and they're superior to the hyoid. Literally the base of the chin. All of these muscles under here are the suprahyoids. And how I like to work those ones is I take my fingers on either side, starting at just underneath the underside of the tip of the chin, and then I just do a nice smooth stroke underneath the jawline. I literally have almost no oil left on my hands, just because I've had the towel over them. You want to make sure, if you do have, wipe your hands very well so that you're not putting oil underneath their chin. Now we also learned about the muscles of mastication. Always when I'm doing a neck massage, I get into some of those mastication muscles. Excuse me. I like to start into the temporalis muscle. Now you can do this if you have no oil on your hand, just like this, or if you think you might still have some remainder of oil on your hands, make sure that you've got a barrier, whether it's a towel or a wrapping, and you can do the techniques through that, okay? So I like to do some nice fingertip kneads right into the belly of that temporalis muscle. Now you can do light ones where you're actually running over the surface of the hair. And then you can also do a little bit deeper where you're basically pushing in enough to pin down the superficial tissues, and you're going to be rubbing the superficial tissues against the deeper layers. So you're kind of moving the whole scalp with this one over that temporalis muscle. And it runs all the way down to the jaw. And then as you're moving down to that insertion from temporalis, you can start to get the borders of masseter. This is that major bite muscle that closes your jaw. And you'll be able to feel it when you feel the joint of the actual jaw just a little bit more ventral to that joint. You'll be able to feel the fibers running down. You can do some nice fingertip kneads. You can do some nicer deep strokes. Some more suprahyoid work. And then I like to make sure I'm also not ignoring frontalis and occipitalis, okay? So you can do some nice fingertip or thumb. I like to even start with my thumbs together on the forehead, and then I spread out over the forehead. It gets frontalis really nice. It's like a deeper stroke, going from midline out. And then moving into scalp. Now I know it says on our schedule that we learn scalp massage a little bit later. When I'm teaching neck massage, I always teach scalp at the same time. As far as I'm concerned, to get a good neck massage, you always need to go ahead and incorporate the scalp muscles as well. So I'm doing a nice alternating thumb knead over frontalis. Moving into the fascia over the top of the head with some nice alternating thumb kneading. And then what I do is I'm on the other side, I'm grabbing the head like this. And then I'm going to tilt him over so that his head is resting in the hand that you can't see. So I can get into occipitalis muscle. And move my way all the way up into that fascia that joins occipitalis and frontalis. And then we'll slowly move over to do the other side. And then how I really like to end is if you look at, once we learn more detailed fascia, the fascia that comes through the skull here over the outside of the skull, it kind of wraps around in a bit of a spiral motion around the ear. So lots of times if these muscles are really, really tight and stuck together and adhesed, the fascia can get very tight and stuck together and adhesed as well. Okay, and this helps contribute towards tension headaches. So to go ahead and give that fascia a nice little pull, what I do is I kind of grab the base of the ear right on the cartilage on both sides, and I do a nice pull. And I'm just going to tug towards the shoulders and a little bit out. And that acts as a nice little pull on the fascia. And then you can end with what we call settling of the shoulders. Okay, now you can do this with the backs of your fingers or with your hands like this. And what I do is I usually time it with the client's breath. And as they are releasing their breath, I will go down and rock the shoulders as I'm moving out. And it just helps to further settle those shoulders down and pull them away from the ears, which is where they like to go up towards when they're tight. And that is a very basic neck massage. Now go ahead at home and practice. Thanks.